thyroid gland is an endocrine organ, a butterfly-shaped organ. It has got right lobe, left lobe, and a bridge connecting those two called isthmus. So apart from these, benign nodule or non-cancerous nodule, which is limited to one part of the thyroid gland, that is either right lobe or the left lobe, we can do removal of either right lobe or the left lobe. Or if the thyroid gland is having multiple nodules, I mean the nodules are scattered all over the thyroid gland, then we can remove the entire thyroid gland. But people were very unhappy with this procedure because many people used to ask, hey doc, this nodule is benign, that is non-cancerous, it's not going to spread. Then why do we have to remove the entire thyroid gland or at least half of the gland? Can't we do something else? The surgery gave many problems. What are those? First, scar. So if a patient has come with cosmetic concern, if a patient wants to get the thyroid nodule removed because of cosmetic concern, or it is compressing the trachea or the esophagus, that is windpipe or foot pipe, you are putting an incision to remove the thyroid gland, either half or the entire thyroid gland, which leads to scar and which is there for lifetime. So to improve one cosmetic concern, you are creating another cosmetic concern, that is scar, which will be there for lifetime. Second, the morbidity of surgery. Surgery is usually performed under general anesthesia, that is, you will be knocked out to unconscious state and surgeon puts incision to remove either the half of the thyroid gland or the entire thyroid gland. Sometimes a drain is inserted after the removal of thyroid gland, which will be there for at least a week, and you will be admitted in the hospital for at least 4 to 5 days. Third, prolonged recovery. So after thyroidectomy is done, that is removal of the entire or the half of the thyroid gland, you will have a lot of disturbances in your routine life, and it will take at least a month to get adjusted to the new lifestyle and daily routine activities. Fourth, voice change. Any rough handling in this area will lead to injury of the recurrent laryngeal nerve, that is the nerve supplying the voice box of your larynx, which will lead to voice change. Also, the intubation from the anesthesia itself has a risk of voice change by causing recurrent laryngeal nerve palsy. Fifth, the major drawback with the surgery is after removal of entire thyroid gland, the patient has to take regular hormonal supplements for his entire lifetime. That is, he has to take thyroxine supplements for his entire lifetime, and the dose needs to be adjusted according to his blood tests. So again and again, you have to visit endocrinologist or the general physician for dose adjustments, and you will have lack of energy feelings at the end of the day after undergoing total removal of the thyroid gland. Also, after total removal of thyroid gland, there are 4 parathyroid glands which are present just behind the thyroid gland. So these are also removed along with the thyroid gland, and this can lead to calcium metabolism disturbances, that is either increase or decrease in calcium levels, and you also need to take regular calcium supplements. So what are the other options? Nowadays, there are many options to treat benign thyroid nodules, that is non-cancerous thyroid nodules, apart from the morbid surgery. The first one, chemical ablation. So when we see it in ultrasound, if it is cystic, if the nodule is filled with water or the colloid completely, then we can aspirate it completely, put half the volume of alcohol, that is to burn the tissues around the cystic space and to cause sclerosis, and again re-aspirate the alcohol injected to collapse the thyroid nodule. So this is an office procedure which hardly takes some 5 to 10 minutes and is done under local anesthesia. Next, thermal ablation of thyroid nodules, that is using either radiofrequency energy or the microwave energy. We burn the thyroid nodule itself when it is solid on ultrasound. To put it in simpler terms, we just insert a small needle directly from the skin into the thyroid nodule and start burning the thyroid nodule using something called as moving shot technique. To begin this, we just put a small needle and inject local anesthesia over the thyroid nodule itself, then put somewhat longer needle of the same gauge to the same axis and inject fluid around the thyroid gland. So when we burn it, the surrounding structures like the carotid vessels, the nerves and the muscles, they don't get burnt or they don't get injured. So after injecting the liquid, that is, we usually inject either normal saline mixed with local anesthesia or the dextrose 5, that is 5% dextrose. After injecting these, we insert a antenna or the electrode into the thyroid nodule itself and start burning and manipulating the needle every 10 seconds so that the entire thyroid nodule gets burnt. So what are the advantages of this thermal ablation of thyroid nodule? First, it's a daycare procedure. You get admitted in the morning, we do the procedure and you get discharged either the same day or the next day. Second, it has got no scar. we need no scar after doing the entire procedure. Third, there is no need for lifelong medications. You will be on medication for some time, that is 3 to 5 days. Apart from that, taking hormonal supplements for lifetime. Fourth, no risk of general anesthesia. This procedure is mainly done after local anesthesia and GI is not at all required. Fifth, there is no need for drain insertion or the other complications which we see with surgery or quite less with this thermal ablation procedure. So if the nodule is of size 30 to 50 cc, ideally 30 cc nodule will take one session of thermal ablation, and anything more than 30 cc, either 40 cc or 50 cc nodule, will take at least 2 or more than 2 sessions for thermal ablation. So the third thing is thyroid artery embolization for goiter reduction, also called as TAEGR. So here we numb the skin over the thigh, we enter the blood vessel which is supplying your leg, go along the blood vessel into the neck, and finally into the vessel which is supplying the thyroid gland. After reaching into the vessel which is supplying the thyroid gland, we inject PVA particles or embospheres which permanently block the vessels which are supplying the thyroid gland. So we have seen lack of blood supply to any part of the body will leads to shrinkage of that organ. The same goes here. The lack of blood supply to the thyroid gland will cause shrinkage of the thyroid gland, and the average time taken for that is around 3 to 6 months. So what are the outcomes with these procedures? These procedures are 99% safe and the results are ensured in 90% of patients. So both of these procedures don't give any scars. There is no need for lifelong hormonal supplements. You need not have regular endocrinology or general physician visits. Your thyroid hormone levels will be normalized and you will be energetic throughout the day, and you can get back to your routine faster than the surgery to prevent thyroid nodule formation after either removal of the thyroid gland or burning the thyroid nodule. Let's see in the next video. Till then, enjoy and have a good lifestyle. Thank you for watching.